Hey guys, my name is Brandon. Today we're going to go over health assessment workbook, specifically Chapter 17, about the nose, mouth, and throat. So like we started off last time, we're going to go over these key terms because I feel like some of these are important. We're going to start off with aphthous ulcers. They are canker sores, small, painful, round ulcers in the oral mucosa of unknown cause. I do have a picture. If you watch the textbook version, you'll see it. A buccal. Whenever you think of buccal, think of cheek. Candidiasis. This is a white, cheesy, curd-like patch on buccal mucosa due to superficial fungal infection. Caries are like a decay in the teeth. Also, candidiasis, if you try to scrape it off, it will bleed and it will scrape off. However, with leukoplakia, that will not scrape off. Cheilitis, that's red, scaling, shallow, painful fissures at corner of mouth. Then you got choanal atresia, it's the closure of nasal cavity due to congenital septum between nasal cavity and pharynx. Then you have crypts, which are indentions on surface of tonsils. Epistaxis is nosebleed. Apulus, that's the non-tender fibrous nodule of the gum. Non-tender fibrous nodule of the gum is apulus. Then you got fortis granules, small, isolated, white or yellow papules on oral mucosa. You have gingivitis, which are red, swollen gum margins that bleed easily. Herpes simplex, cold sores, clear vesicles with red base that evolve into pustules, usually at lip-skin junction. Leukoplakia is a chalky, white, thick, raised patch on sides of tongues, precancerous usually. Malocclusion, it's the upper or lower dental arches out of alignment. Then you have papillae, it's like rough, bumpy elevations on dorsal surface of tongue. Parotid glands, pair of salivary glands in the cheeks in front of the ears. Those are the biggest ones. Pharyngitis, inflammation of the throat. Plaque is soft, whitish debris on teeth. A polyp is a smooth, pale gray nodule in the nasal cavity due to chronic allergic rhinitis. The difference between a polyp and a turbinate is the polyp is very vascular. Rhinitis is a red, swollen inflammation of nasal mucosa. Thrush is oral candidiasis in newborns. Turbinate, 1 of 3 bony projections into nasal cavity, and uvula is a free projection hanging down from the middle of the soft palate. So let's talk about functions of the nose. Obviously, the nose moistens, filters air, and is a sensory organ for smell. Nasal cavity is actually much larger than the external nose would indicate. It's pretty cool. That's alright. 4 sets of paranasal sinuses. Sure. You got 4 sets of maxillary and frontal sinuses or accessible examination. We already knew that. Okay, let's talk about the parotid salivary gland. It's the largest, like I said earlier. It lies in the cheeks, in front of the ear, and extends from the zygomatic arch down to the angle of the jaw. Its duct, Stinson's duct, runs forward to open on the buccal mucosa of the second molar. So you have the submandibular gland, like the size of a walnut, lies beneath the mandible at the angle of the jaw. Should be pretty easy to remember. Submandibular, mandible. Its duct, the Wharton's duct, runs up and forward to the floor of the mouth at the side of the frenulum. Stinson, okay, pretty easy. Then you got sublingual gland, smallest, almond-shaped, and lies on the floor of the mouth under the tongue. It has many small openings along the sublingual fold under the tongue. Let's talk about what are some of the consequences of tooth loss in middle or older adults? Well, excessive bone resorption with further tooth loss. You have muscle imbalances, and you can get TMJ. Alright, let's talk about what's the difference between a deviated nasal septum and a perforated septum. Deviated nasal septum looks like a hump or shelf in one nasal cavity, and the perforated nasal septum is like a spot or light from a pin light that is shining in the other. Okay. Torus palatinus, it's normal variation, nodular bony ridge down the middle of the hard palate. It's just a benign growth that occurs after puberty. Native American and U.S. Asians. What's the difference between leukodemia, candidiasis, leukoplakia, and Fortis granule leukodemia? Large grayish opaque patch that may be present along the buccal mucosa. It is more common in blacks or East Indians. When it is mild, the patch disappears as you stretch the cheeks. Severity increases with age, and it looks grayish, white, and thickened, and we're not sure what causes it. Candidiasis. Monoleal infection is a picture on the textbook. Full review, it's a white, cheesy, curd-like patch on the buccal mucosa and tongue. This does scrape off, leaving a raw red surface that bleeds easily. Leukoplakia, another picture on the other one, is a chalky, white, thick, raised patch with well-defined borders. Well-defined borders. Not well-defined borders. The lesion is firm and does not scrape off. This does. This one doesn't. Due to chronic irritation. These are precancerous. Fortis granules. They are small, white or yellow papules in the mucosa of the cheek, tongue, and lips. Painless sebaceous cyst and not significant. Okay, let's talk about the 4-point scale of the tonsils. Did this one a couple times, but 1+ is visible, 2+ is halfway between the tonsil, the papillae, and uvula, 3+ is touching the uvula, 4+ is touching each other. Now let's talk about the clinical findings, significance of sucking tubercle, Epstein pearls, and Bednar apathy. Sucking tubercle is a normal finding in infants, a small pad in the middle upper lip from friction of breastfeeding or bottle feeding. Epstein's pearls, a normal finding in newborns and infants, small white glistening pearly papules in the hard papillae and on the gums. They look like the teeth. They are small retention cysts. There's a picture of retention cysts. You can see those. They're pretty cool. Not too bad. Disappear in the first few weeks. Bednar apathy, traumatic areas or ulcers on the posterior heart. I think these are the worst ones. Traumatic area or ulcers on the posterior hard papillae on either side of the midline from abrasions while sucking. Nasal turbinates and nasal polyps. Like I said, I don't know. I don't know what I said. But that's everything there that I can do. I do have some questions. So, what is the most common site of nosebleeds? That's going to be the Kieselbeck plexus. If you listen to the textbook, what sinuses can you assess through examination? You listen to the textbook. Are you listening to this earlier? You know it's the frontal maxillary. What's the frenulum? Listening to both against the midline fold of tissue that connects the tongue to the floor of the mouth. The largest salivary gland is located where? Well, what is the largest salivary gland? It's the parotid gland. It's located in the cheeks in front of the ear. Okay, so let me ask you this. 7-year-old reports dry mouth. What's the most frequent cause? If you take anticoagulatory drugs, you know that decreases salivation. So medications would be what you want to look at because that's the cause. So during an inspection of a patient's nares, deviated septum is noted. What would you do? Document it just in case the patient needs to be suctioned. There's not really nothing wrong with it. It's just for being suctioned. It's kind of important. Where are oral malignancies most likely to develop? Well, in the mucosal gutter under the tongue. Talked about this just a second ago. What tonsils are graded as a 3+? What does that indicate? They are touching the uvula. What are the function of the nasal turbinates? Remember, warms inhaled air is one of the functions, mainly. So, the opening of an adult's parotid gland, the Stinson's duct, is opposite to what? So, if the Stinson's duct runs forward the buccal mucosa of the second molar, lower, obviously the upper second molar, opposite. So, upper second molar is opposite to that. Again, like I said, nasal polyp is different from the nasal turbinate, except for the polyp is not highly vascular. I think I said it wrong earlier. So, what about this? The examiner notes small, round, white, shiny papules on the hard palate and gums of a 2-month-old infant. What is the significance of this finding? Epstein's pearls, that's what it is. When assessing the tongue, what do? You palpate the U-shaped area under the tongue. So, you are assessing a 75-year-old patient's oral cavity. Which of the following will most likely be present? Well, they won't be able to identify odors that easily. And then you are assessing an African American patient and note a flat 3 centimeter non-tender grayish white lesion on the left buccal mucosa. The following is most likely to be. What about that one? Leukodemia. Easy. Alright, well, I hope y'all enjoyed. This actually lasted 10 minutes. Surprisingly not that long. Alright, see ya.